Good afternoon. I wanted to take this opportunity to give you more than just an update to the numbers. I realize that when you look at these numbers as much as I do, it is easy to forget that not everyone does the same. Also, since the trustees and I use this information to make decisions, it is important to explain how I use the data and why I prioritize some information over others. Having a better understanding of the data is important to making informed decisions related to COVID-19 that are based on knowledge and respect rather than emotion and fear. With all the data, it is important to remember that the goal of all of our efforts has been to ensure that the hospital system and our medical resources are not overwhelmed. Cases are what we regularly hear about from the press and from the governor. For me, cases do not really tell the story for several reasons. The sheer number of tests. The more we test, the more cases we have. For example, at the peak of our resource usage, near the end of April, we were only performing a little more than 10,000 tests per day. Just 2 weeks before that, it was only 6,000. Now we are testing well over 40,000 a day. Many people who test positive multiple times, especially those people in the hospital. Each of these positive tests is counted as a positive case, which will obviously inflate the numbers. I have personally heard over a dozen anecdotal statements from people who went to get tested, signed up, waited for a really long time, left without taking a test, and received a card in the mail saying they tested positive. This is obviously problematic. Reporting problems. Many times labs don't report their results each day, so the number of cases and tests fluctuate wildly. One way to partially account for the case count related issues is to look at positivity rates. However, that is also problematic. In the beginning, there were more people who had COVID that were told to stay home since they weren't very sick and not getting tested because tests were limited. We needed tests for the sickest patients to confirm the diagnosis. That makes sense because those were the people who we were most concerned about. However, now that we have plenty of tests, repeat testing of positive patients, and a general proclivity to test sicker patients all lead to a skewing of percentages. Moreover, the percentages can be driven lower by testing people who you know are not sick. In the end, while positivity rates help provide more information than cases alone, they also don't really give us an accurate picture. The number that tells the full story of what is happening is the number of new COVID hospitalizations each day. The number only lags a few days at most and is accurate because we know that a person who has been hospitalized and has a positive test has COVID. Also, remember, one of our biggest concerns is the hospital systems being overwhelmed. This statistic really tells the full story. Near the end of April, suburban Cook County had about 125 new hospitalizations each day. For the last 6 weeks, it has been less than 10 a day and has held relatively steady. This is important for a number of reasons. One, asymptomatic cases or mild cases are not overly concerning, provided hospitalizations are down, because they increase herd immunity and do not impact the hospital system. These cases are especially common among younger, healthier people who make up much of the current COVID exposures. Two, we have opened much more and there is much more interaction, but serious cases are not going up. Three, this is all about the hospital system. Even the CDC has admitted since the onset of the pandemic that we can't completely avoid virus exposure. Instead, our goal needs to be to ensure that those exposed to COVID-19 who need medical attention can receive the care they need. To understand the trends, it is also important to look at total deaths. We all know by now that anyone with COVID is labeled as a COVID-caused death. For example, here in Orland Park, 97% of the deaths had previous serious health conditions according to the Cook County Medical Examiner. The point I want to make is that it doesn't really matter how COVID deaths are labeled as long as it is done consistently. This is because the trend in deaths across the state and suburban Cook County is what is important. It is also important to note that deaths is a lagging indicator and trails what is happening with cases by a few weeks. The state and county death totals also indicate that we are doing well. Other important statistics are COVID-related hospital resource usage across the state and region. Regionally, we have had ample resources available for a long time. When we look across the state, we can see that ICU and ventilator usage is way down from the peak. Additionally, and most importantly, the number of total daily hospitalizations are way down from the peak and not increasing. The economy across most of the state is far more open and COVID hospitalizations still remain flat. All of this information makes last Friday, when the governor used the case count, which I just explained isn't really painting the full picture, to justify criminalizing businesses that don't force customers to wear masks. Even harder to understand. Putting aside whether he has the authority to criminally penalize business owners and managers without the legislature passing a law, is this really necessary based on the current facts? Remember, on May 15th, he tried a similar tactic. However, the legislature did not support this and he dropped the request. After this, the Illinois Emergency Management Agency said, and I quote, "Businesses should be informed that state licensing agencies may become involved should they reopen prior to authorization from the governor." They added, quote, "Immunity may not apply to the principal executive officer or an agent or an employee or representative of a political subdivision should it be determined that a failure to enforce the EO resulted in gross negligence or willful misconduct." Threats are not helpful. Let's look at what happened since the threat to jail or fine business owners was withdrawn on May 20th to now. Cases have gone down dramatically, even upon reopening. Did we really need to threaten criminal action against business owners to see improvement? No, we did not. Now we have steadily low hospitalizations in spite of more opening, yet the governor resorted to making these threats again. Why? In my opinion, based on the data, it really makes no sense. What is the goal? It surely isn't to make people confident or calm people's fears. In any case, the flat hospitalizations, both statewide and regionally, suggest that the governor's actions last week are unnecessary. Something else I have talked about a lot is that the ages that are most impacted by COVID-19 are the elderly. This is demonstrated by the hospitalization rates and deaths across age groups. Why do I think this is important information? The reason is because we are making decisions that are very important and largely impact certain age groups. First, long-term care facilities have been a major issue nationwide, but particularly in this state. 54% of deaths have been in long-term care facilities. In Orland Park, that number is over 95%. Also, the average age of death in Orland Park is 84.8, according to the Cook County coroner. This tells us that we need to be extremely careful on both visitation and operation in long-term care facilities. It also tells us that we need to do much more than we did. We must do better going forward. Second, decisions are being made about schools and youth sports as we speak. We know that only 45 deaths have occurred under the age of 15 and 225 from 15 to 24 from COVID nationwide. This compares to 328 and 378 respectively for flu and pneumonia deaths under the same time frame. If you look at Orland Park's cases by age group, there are only 83 cases under age 20. The highest number of cases is from ages 20 to 29. Yet our average age of death in Orland Park is 84.8, as was stated. We have had 2 deaths in the 60 to 70 age group, 9 from 70 to 80, and the rest from 80 plus. So not a single death under the age of 60. For decades, we have actively decided that the benefits of having students in school are worth the risk that they may catch the flu, accounting for the risk to themselves as well as their families, especially elderly family members. It is also important to note that for ages 10 to 14 and 15 to 24 and 25 to 34, the second leading cause of death annually is suicide. Mental health is very important, and not going to school and not socializing with other children has a profound impact on our children's mental health. Frankly, fear-mongering has an impact on everyone's mental health, particularly our children. All these facts are important to consider when making decisions regarding our young people, whether it be school, sports, or other extracurricular activities. It is also important to explain why I focus on the suburban Cook County and regional numbers. There are several reasons, including Orland Park numbers are by zip code and include Orland Hills and unincorporated Orland Park. Orland Park by itself is not only a small sample size, but Orland Park is also impacted by others in the region. Orland Park is still staying flat with low positivity rates. The cases, however, do jump up and down from day to day based on the number of tests being reported. Some data is available at the suburban Cook County level, some at the emergency response regional level, and lately some based on the new IDPH COVID regions. We have to work with the best information and data sources that we have. The regional data includes hospital resource data. Remember, protecting our hospital resources was the whole reason for the lockdown. This data, along with the daily COVID hospitalizations by report date, are the most important data to be focused on. In a perfect world, IDPH and the Cook County Department of Public Health would also track and report occupational data of positive COVID cases. That way, we could identify clusters and/or develop a better understanding of how this is transmitted. However, IDPH has admitted to not being diligent about collecting this information. Additionally, neither IDPH or CCDPH will share address information with the village due to HIPAA laws. This makes it impossible to quarantine the sick. However, the county is demanding that we quarantine the healthy that come from other states for 14 days. This makes no sense either. I hope that this video helped explain the rationale for why we focus on some data more than others. The information we are getting is not perfect, yet we still need to make difficult decisions. The majority of the board and I feel it is important that we are transparent about how we are using the available information to reach these decisions. Orland Park has done a great job throughout this crisis. We are completely open based on our safe reopening plan. We have held our July 4th event, The Taste of Orland, a concert in the park, and markets in the park. All the while, we have continued to show encouraging data trends that suggest we stay open and keep doing what we have been doing. Please continue to do what you have been doing, as it has helped. Orland Park is an example for the rest of the state to follow regarding opening. Thanks to your efforts. Thank you.